Today I'm going to be talking about infectious skin conditions, and there's three main things that I want to cover with you. First of all, I want to talk about viruses, and we all know about a lot more about viruses now than we did maybe a year ago, thanks to COVID and the coronavirus. So there are viruses that can affect your feet. The human papilloma virus is the common virus that affects feet in the form of verrucas. And there's four main types of human papilloma virus that affects the feet, and they present a slightly different presentations of verrucas. Now, verrucas are caused by this virus, and the virus causes changes in the skin cells, and that makes them look different on the skin, and they can be troublesome, they can be painful, they can spread, but equally they can be benign and not troublesome at all, and therefore they don't always need to be treated. And it's very much down to what you want as a patient with regard to treatments that we might give for it. There's an array of treatments available, from weak acids to stronger acids to freezing treatments to verruca needling to swift microwave therapy to Verutop to surgical excision, all sorts of possibilities for verrucas, and it's just a matter of identifying which one might be the most suitable for you, if indeed any treatment is suitable. So if you've got a troublesome verruca, then it's worthwhile getting an opinion on what can be done. Sometimes it's just the location of it or the build of hard skin over the top that is causing the problem, and therefore we can do something about that. But verrucas are contagious. They can be spread to other people, which is why we've put it in the infectious skin conditions section. You can catch them from other people. But it needs to be when your skin is in the right situation and their skin is ready to shed the virus, although the virus can lie dormant around us for quite some time. Another infectious skin condition is fungal infection. Now, fungal infection we mentioned in the nail conditions because it can affect the nail, but it can also affect the skin on the feet. And typically that would present as athlete's foot, so that's moisture and flaking between the toes, sometimes itchy, but equally it can affect the whole of the sole of the feet, often presenting just as dryness. And all too often we see patients who use lots and lots of moisturising cream on their feet and they get nowhere, and that's because they've got an underlying fungal infection. So getting professional assessment, we can do investigations with something called the 5-minute fungus test, where we actually use like a pregnancy test strip type thing to identify if there's fungal elements present, or we can send samples off to a laboratory to confirm the presence of fungal infection and then treat it accordingly. And then the third type of infection that you can get in your feet, which isn't as infectious, as in you're not going to easily share it with somebody else, unlike the fungal infection and the viral infection, but you can get bacterial infection in the feet. So that's the presence of pus, for instance, inflammation, redness, cellulitis, for instance, around an ingrown toenail, or if you've got a foreign body or an ulcer. All these things can cause bacterial infection. You can get secondary bacterial infection, secondary to fungal infection in an area as well. Now, bacterial infection sometimes needs antibiotics, which we're able to provide for patients, but more often than not are able to resolve it with conservative measures, resolving the problem that caused the bacterial infection in the first place. All too often we see patients who had ingrown toenails, for instance, had multiple courses of antibiotics, and it doesn't cause the problem until you resolve and cut away the bit of nail. Well, it can be the same with a skin infection. So if you've got an ulcer which is infected, unless you actually get the ulcer to heal up, then the infection is just going to sit there recurrent as a problem. And sometimes that infection can spread deep to the bone, and we need to be aware of that, and we can check out whether that's the case, particularly that happens in high-risk feet like diabetic feet, which we'll be talking about later on in the week. So I hope you've enjoyed this whistle-stop tour of infectious skin conditions, and we'll see you again tomorrow. If you have any foot problems, don't forget to call us on 01926 811 272 or visit healthfirstsoutham.co.uk or subscribe to our YouTube channel, Health First Foot and Gait Clinic. Thank you. Bye.